Welcome back, everyone. Once again, we're taking a look Eye on Vision. We have Dr. Matthew Witmer, representing Retinal Consultants of Arizona, with us to answer some questions. Thanks for coming, Dr. Witmer. Okay, we've got some questions from social media. One, Sarah from Lake Havasu says, do you accept Medicaid patients? She has Sjogren's disease, a mixed connective tissue disease, and type 1 diabetes. She's on a couple drugs, Plaquenil and Methotrexate. She's 55 years old, and her vision is deteriorating. What do you suggest she do?
So, first of all, we do accept Medicaid patients for sure. Plaquenil is a medicine that's typically used for conditions like lupus and rheumatoid arthritis, but also can be used for Sjogren's disease. It can cause some retinal toxicity in a small percentage of patients that have been on Plaquenil for a number of years. So it is important for her to see a retina specialist to see if it's affecting the retina at all. If you've been on it for a number of years, typically it takes, to have been on the medicine for 5 to 10 years. But it's certainly a good idea to be checked out to see if that toxicity is one possible reason why she could be having some deterioration of her vision.
Okay, we'll do that. Next question, Daniel from Havasu says, many years ago I was accidentally shot in my left eye with a BB. Cataracts formed in the eye and the lens was removed but not replaced. That was many years ago. Would a lens transplant help get vision back now? He can see maybe 8% of light. Last time I went to an eye doctor, he said I also had a detached retina in the left eye. Since I don't use the left eye, is there any need to reattach the retina? Well, that's a good question.
Well, yeah, it sounds like, that was a pretty significant injury.
Yeah.
And he had damage to multiple parts of the eye, the lens inside the eye, which was removed, and also the retina, which is detached. So I guess the first visual limiting condition is the retinal detachment. Without having an attached retina, it's very difficult to be able to see well after having such a significant trauma. So I would say it's important to be checked out and evaluated by the retina specialist first and foremost to see if reattaching the retina is a possibility. If you can get the retina reattached surgically, typically it's performed surgically, then perhaps inserting a lens implant would be the next step to try to maximize the visual potential. So I do think it's still a possibility if you can get the retina attached for the vision to improve.
It's possible. Okay, check it out. And Michael from Kingman says, an eye doctor told me I have a nevus in my retina and suggests I see a specialist. What is a nevus and is it dangerous?
So a nevus, when it comes to the eye, is typically a choroidal nevus, which is basically a freckle.
Oh.
It's basically a freckle in the eye, but it's underneath the retina, behind the retina. They're very common. You see them all the time. About 5 to 10% of the population will have a nevus in the eye. In a very small percentage of patients, they can grow and turn into a problem, such as a cancer in the eye, a melanoma. So it's important to be evaluated by a eye care professional to know if it's a dangerous nevus or just one of the typical nevuses, freckles that you'd have anywhere on your skin. They're very common. So generally
watch it. Make sure it's not growing.
Yeah, make sure it's not growing. The doctor will be able to tell you how it's behaving.
Okay. And Alice from Havasu says, what can happen to your eyes when you look directly into the sun? People say it can burn your retinas. Is that true?
So yeah, there is a condition if you do look right into the sun. It's called solar retinopathy, where you can cause damage to the retina by direct sunlight, sun exposure. So that is true. You can it can cause some damage to the retina if you look right in the sun. Generally speaking, it gets better over time, but as just a general piece of advice, not a good idea to look directly into the sun, and because it can damage the retina, and also sun exposure can damage other parts of the eye as well.
Okay. So sunglasses, number one tip, right? Especially here in Havasu. Well, let's talk about some summertime eye care tips. Sunglasses, probably get the best you can, right? Yeah, you want to make sure that when in terms of sunglasses, that you're being protected from the harmful rays from the sun, specifically ultraviolet radiation. UVA and UVB protection is very important. If you, in addition to wearing sunglasses, I think wearing a hat outdoors to block yourself from the sun is excellent for protecting your eyes and also your skin.
If you're in the pool, wearing goggles is important because that can protect you from sun exposure. And
yeah, the sun's probably glaring off of the water you're in too, and probably even brighter on your eyes.
Absolutely, absolutely.
And wear goggles.
So those are all really important things to do this summer, just to protect yourself from the harmful radiation that's coming from the sun.
Okay, and what can we eat for eye health?
Oh, so there's a number of things that are important for the eyes. Fish, fresh fish is usually a good which has fish oil, omega-3 fatty acids, which are important for keeping your eye moist and not developing dry eye. In addition, for the retina, green leafy vegetables have been shown to be beneficial, and the old wives' tale about carrots actually sometimes is true because it contains good vitamins and minerals in vegetables like carrots that are protective of your retinas.
Okay. Any supplements we could take? Just
Sure.
vitamin, minerals, just supplements if we.
Yeah, there's a number of different eye supplements available. Typically, when it comes to the retina, they include the carotenoids like lutein and zeaxanthin.
Lutein, I've heard of that. That's good to take.
Is an important one, yeah, specifically for patients with macular degeneration.
Is that something you need a prescription for, or can you just buy lutein?
Those are all over the counter.
Okay.
Yeah, you can buy those at
check that out.
any pharmacy would have access to those.
And they'd be good. Okay. Good eye health. Good ideas. Thank you, Dr. Witmer from Retinal Consultants of Arizona. And think about that. Get some good eyeglasses and sunglasses and hats for the summer, right?
Stay protected
Okay.
from the sun.
Thanks. We'll see you next time. We'll be right back.
All right. Thank you.